a roundtable event with the experts. Pam Roussel with Perfectly Holistic, Julianne Thorne with Naturally Cats, and none other than Dr. Katie Woodley, the natural pet doctor. Thank you, ladies, for joining us.
Thank you so much for being here this
Thank
morning.
you so much for being here this morning.
I'm just so excited to see your faces. It's been so long. And this is such an exciting topic.
It really is.
That I don't even know where to. I'm so glad you were paying attention because
I looked and we were playing with Annie and I was like, 1 second, go. So today's topic is all about how to avoid over-vaccinating your cats. And this is a very important topic that I feel like is not talked about enough, especially in the cat world. And so we are going to bring it to you guys today so that we can all have that knowledge moving forward and make the best decisions for our kitties, right?
Real quick, like around the horn, where does that even come from?
I don't know. I don't think that's the saying. I think that's wrong. I just go around the horn.
What experience, let's just go around real quick, of any experience that you've had dealing yourself with over-vaccination with your babies or dealing with clients?
Well, actually, before we get started on that, just to keep it like flowing correctly, right? We want, a lot of people don't even know what over-vaccinating is, right? So we want to discuss like, what is this, what is over-vaccination? Dr. Katie Woodley, could you tell us a little bit about the potential side effects, short-term and long-term, when it comes to vaccinating your cat after they are already immunized?
Yeah. It's kind of a controversial topic, right? And also too, there's chaos going on behind me with my cats. I don't know if anyone's noticed that. They're all very active today. So if you need entertainment, just watch behind me. Yeah. So in terms of vaccinating though, in terms of like adverse side effects, why do we vaccinate? All these questions that come up, I think the big thing here to keep in mind is most veterinarians are practicing what they're taught in vet school. And so there's a concern about infectious diseases that can be occurring for, these cats that they're coming into contact with, like calicivirus, panleukopenia, your herpes virus that can create, runny eyes, the snotty nose, the upper respiratory infections can cause liver issues, inappetence, they go off their food. And some of these diseases can't even be deadly. Feline leukemia is a very, it's a topic that, with vaccines, there is a vaccine for it.
Yes. Such a serious topic. And then Batcat comes through the cave.
I am so sorry for that. There's another cat still in there. So there's Chico in there too, who's our actually over-vaccinated cat. So, but going back to that, for anyone who didn't catch that, you can rewatch that chaos. I'm glad my curtain and thing didn't come down from the wall. But the big thing is there are diseases that our cats can come into contact with that can make them very sick, which is why there are vaccinations developed to help protect our cats. And so there's a vaccine schedule that we're taught where we start with, our kittens at a young age, providing antibodies against these diseases. The antibodies are what protect our cats when they come into contact with those viruses to help keep them safe so they don't develop the illness and the disease that comes from that. Now, the problem is that, and there's numerous studies through Dr. Jean Dodds and Dr. Ron Schultz that showcase that we're actually over-vaccinating a lot of the times with the routine vaccine protocols that are in place with most veterinarians, where we're giving, potentially 3 to 4, sometimes even 5 vaccines to these cats, all before 1 year of age. And we have studies that showcase that one vaccine is preventative for that condition for life. So they're able to mount this immune response from the vaccine that provides these antibodies that protect them. So what happens when we're talking about over-vaccinating? So when we give a vaccine, it's stimulating the immune system. So we're stimulating these B cells, these T cells, the adaptive immune response to produce those antibodies. And what happens is if your cat comes into contact, say, with a herpes virus, calicivirus, panleukopenia, or even leukemia, is their body will naturally now mount an appropriate immune response to inactivate that virus so they don't get sick. But when we give the vaccine over and over and over again, what can happen is that that cat already has those antibodies. Their immune system is already capable potentially of dealing with and inactivating that virus. But when you stimulate the immune system again, we can actually overstimulate that immune system. So now what we've done is that we've created this overstimulated immune system that now is producing all these inflammatory mediators. They don't know what to do. They can actually start attacking their own tissues. And we end up with these chronic long-term conditions like itchy skin. We can even see upper respiratory infections. We can see inappetence. We can actually see kidney issues, inflammation, liver inflammation. The spleen can get inflamed. And what happens then is because it's delayed, usually onset, it's not usually immediately. Anaphylactic reactions can occur where you give the vaccine within 15, 20 minutes, your cat is like, usually they vomit, they have trouble breathing, they need to, they need supportive care or else they will die from that anaphylactic reaction. But the problem is that these vaccinosis reactions are delayed onset. They don't happen right away. So when you go to your vet and you say, my cat got these vaccines and now a month, 6 weeks later, even months later, they're now having these adverse side effects, your vet will probably say, causation doesn't equal or correlation doesn't equal causation. So because it didn't happen immediately, that's the hard part when you go to the vet. And that's where a lot of vets dismiss this vaccinosis diagnosis and say, how can you actually say that it's due to this? But it comes down to what are we doing when we vaccinate and what's happening with that immune system that's creating this over response. And the cat behind me, the one now wrecking the chair behind me, that's Tico. He actually had a vaccinosis reaction and we were able to see, it was very scary. He almost died from it. We were able to see, we thought he had lymphoma because of the inflammation in his spleen and his liver and his kidneys. And this specialist didn't even know what was going on. And it was a delayed reaction from a rabies vaccine. So I can tell you personally, these things happen, not just with my own cats, but also seeing and working with a lot of clients that have dealt with this and have dealt with these delayed reactions. And I know Pam, I know Jane, Adrian, you've dealt with it personally. We've talked about Julianne. That the thing is that this is a real thing, but there's so much we can do to make sure we're not over vaccinating, but still protecting our cats to prevent that vaccinosis from happening. So that's a key thing to keep in mind. There are things we can do if you have to give vaccines. There are natural remedies you can use to help calm down that immune system, but allow an appropriate immune response to keep your cats protected.
Yeah. Well, I mean, I think, the thing that we've learned and that we continue to say is that more vaccines do not equal more protection. And I think that's, even in the human world, when it comes to these pandemic diseases or whatnot, people think that the more booster shots you get, the better you're going to be protected against this or that. And they think the same with our animals. And that's kind of what they've pushed. Right. And so it leads us to believe that every time we vaccinate our cats, it's actually the healthy thing. It's helping them, right? And so that's why I love the way that you said that, Dr. Katie, because it's so important for us to understand the truth behind it, and that we see these vaccinosis reactions, these vaccine reactions that are usually delayed, like Pooh Bear, right? Many of you guys know about our Pooh Bear, and we, he was over-vaccinated with the rabies shot, and he ended up with the autoimmune disease, and it was really, really scary. And we had to do a lot of work with him over
did Pam.
And so did Pam, and so did Katie, for many years of his life to try to get that under control. And it wasn't fun for him, and it definitely wasn't fun for us either to deal with. So we would just want to try to help you guys avoid that at all cost.
I wanted to ask Julianne, I know that you do such a powerful work with communicating with our cats, right? And I think that so often, what we went through with Pooh Bear, he was really dealing with that rabies vaccine, that extra shot for a long time. And we didn't have the opportunity to talk to him with you. But do you see that a lot where, especially since I think so many cats that are dealing with issues, and I know that that's where people bring cats to you too, so many cats dealing with issues that are illnesses that they don't necessarily realize that it's from this, and that people are still vaccinating their cats when they have an illness. I saw someone dropped a comment about once my cat was diagnosed with cancer, all vaccines stopped.
Right, that's another discussion.
Yeah, that's next point. But what has your experience been with over-vaccinating that you've seen?
I have to say, like, I am truly grateful that I haven't had a direct experience. So, you know, I only learnt about the dangers of over-vaccinating, you know, in the last few years. You know, and I stopped giving them to Pickle because she was an indoor cat and I didn't want to put unnecessary anything in her body. She was already diabetic, you know. I was learning about like injection site reactions and things, you know, at that time. So for me, for her, you know, we didn't do the boosters and things. Then when I got Leo, I was like, do you know what? I need to do things differently. So what can I learn? What didn't I necessarily have experience of before that I can learn about? So vaccines was something, you know, he was only 4 when we got him. So I didn't know what the right thing was to do. You know, it's like the doctors and the vets, they say one thing and I'm like, I don't trust that anymore, you know, because Pickle was so poorly for so long. It took us so long to get her even diagnosed with diabetes. Like, my vet says one thing to me and I just don't know if I trust it anymore, which is in a way heartbreaking. You know, I spoke to my vet about what options we had for Leo because he is an outdoor cat. So, you know, I believe that you've got to look at the individual factors for each cat. We did do a booster. I think it was the first 12 months we had him because he'd been feral for 18 months. But I didn't know to ask what they gave him when we got him from the rescue center. And this was only a couple of years ago. You know, I didn't think to ask. He was feral for 18 months. You captured him. You tipped his ear. You neutered him. What vaccines did you do? You know, my vet said to me, we need to do this. We gave him a booster. Thank the heavens. We didn't have a reaction. Or did we? Because 3 months after we got him, he's asthmatic. So I don't know. Like, I can't go into that space because there is part of me that worries that is as a result of what we did. So people don't generally come to me for vaccine issues. You know, I don't deal with health issues with cats. It's more behavior stuff and the emotional side of it. I know, you know, Pam and Katie got a lot more experience than I have with sort of like the treatment, but I can't help but wonder, you know, I just can't help but wonder whether what I said at the beginning, that I've not had personal experience, whether I am actually dealing with that with his asthma.
Wow. Yeah. It's, I mean, and it's really sad, you know, it wasn't until we talked to Pam even that we had thought, because we had learned about these diseases, specifically what Pooh Bear was dealing with. And we were researching and we were like, I feel like this is possibly an over-vaccinating response. Like, this is why he's dealing with this. We put the, you know, timeline together of when we rushed him into the ER and they were like, do you have paperwork? And we were like, no, we don't have his paperwork, but he's been vaccinated. And they were like, well, we need to vaccinate him. So in order to see him and heal his huge abscess wound that he had. And so it wasn't until we talked to you, Pam, and you did an optimal health analysis for him. And we had just met you and you went through and you were like, this is, and a lot of his reactions too, he was also very combative. He acted in ways that would mirror even a rabid animal. And it was Pam that was our godsend. That was able to see this and then put together a wonderful detox process for him. And this was years after he had been diagnosed, years after he had the vaccine, and we were still able to go through this beautiful detox process using homeopathy. Can you tell us a little bit about what you deal with? And I know you deal with it a lot.
Yeah, with the detox. Time out on that for just a second, because I see some comments coming in, and I just want to say, as far as like some of the things that we can do to avoid over-vaccinating, right? There are some core vaccines that are needed. We never want to vaccinate when our cats are sick, when they're injured. But that was the big mistake I think that we made with Pooh Bear, was if you're bringing your cat in for a health issue and they're like, I'm sorry, we can't see them until, it's like, no, you don't vaccinate. And every vaccine will say that, not to vaccinate an ill cat and not to vaccinate an injured cat. Their body is already dealing with so much. So those two just right there for people that are going in
if possible.
Okay.
Right.
Onto the detox, Pam. Sorry, I had to say that.
No, can I just make another statement regarding that before we talk about the whole detox thing? I lost a cat to an adverse reaction to vaccines. He died in front of me. And so if you don't think I don't have a personal stake in this topic, it makes it like I'm about to cry.
Oof.
Because it should never have had to be done. Number one, he had already been vaccinated. I don't know how many times before that was because I didn't know better. And then I was trying to board him to go on vacation, and the kennel place required an up-to-date. Now, where the hell do they get the authority to decide that they need up-to-date vaccines? Number one, I have a real problem with that. Because if you've been vaccinated and you are a healthy cat, you should be able to go into a boarding facility without that hanging over your head. But I was hamstrung. That was like, it was a non-negotiable, and I felt terrible. I felt like I was being forced to do something that I didn't feel comfortable with, but I didn't have a choice. And now I know better. So I'm very protective about my clients, and I'm very supportive about my clients and my own cats, knowing what I've gone through. I don't want anybody to have to go through that. Yeah. And I've learned a lot from Dr. Will Falconer about the whole vaccine thing. And I'll share some things that he suggested later in our talk about these apartment complexes and people that are requiring, who are not medical professionals, requiring, vaccines for our cats that are really contraindicated, not necessary, can put them in threaten their health. So I'll share with you what he very brilliantly put together later on. But so I have a personal stake in this, and it is a very painful thing to go through, and the guilt that we carry, knowing that, okay, I made that decision and look what happened. So we have to forgive ourselves, number one. When you know better, you do better, obviously, or we do the best we can with the circumstances that we have. So did you want me to talk about detox? I totally lost the train of thought.
Actually, let's go into real quickly the titer testing. I really want to talk about it because we see so many comments here saying, but what about the rabies? What about the law? When they say that, we have to get it yearly. First of all, the American veterinary AM, whatever. There you go. Whatever.
Wasava vet guidelines.
Okay. So the vet guidelines actually say, is this correct, Dr. Katie? They actually say that it's 3 years now is required. The yearly vaccine anywhere in the States, at least, is not required by law. Now it is, like, even though like the other ones are like a 3-year. Is that correct?
So you're going to have different things with different vaccines. Keep that in mind. We're talking about there's multiple vaccines that are part of, so WSAVA, WSAVA guidelines. Anyone can print this out. It's the World Animal Veterinary Association, and it details out the protocol that your veterinarian should be following. It was recently updated. I think it's been a couple years. When I say recent, like a couple years ago, for cats specifically, to better protect them against things like fibrosarcomas, which is an aggressive cancer. And so with your rabies vaccine, this is, and I feel everyone in the comments, I've had cats with vaccinosis personally that almost died. And also been on the flip side of being the veterinarian who was also working in a clinic that vaccinated cats every year because it was a moneymaker. I didn't make those decisions, but I worked for a vet who did. And I've seen that not every vet is thinking like that. Keep that in mind. But here's the thing. There are 2 different types of rabies vaccinations. There is a 1-year label and there is a 3-year label. There is also a thimerosal-free rabies vaccine. So you can ask your veterinarian to use the rabies vaccine that's labeled for 3 years, and it is the mercury-free, thimerosal-free vaccination. You can actually, like, there's places where you can order this too. I have a lot of clients and like that do this and bring it to the vet. So this is where having that conversation or working with a veterinarian who is open to having that conversation, because unfortunately in the States and many of the states, rabies vaccine is a requirement, but we need to be making sure that we're doing it every 3 years and we're not overdoing it. Now, the problem is with a young animal, right? They're going to be recommended at 1 year. So you need to do the 1 year rabies. They usually do a 1 year label rabies vaccine. This is where people get stuck. But if you can get that 1 year, it is the same thing as the 3 year label. And talk to your veterinarian to see if they can accept titers. Titer testing is where they draw blood. They're looking at those antibodies. Remember, those antibodies are the thing that are protecting them. So if they ever came into contact with the virus, it's going to deactivate it and protect them. It may not be 100%, right? But it's most likely going to work. That one injection of the rabies vaccine, that one injection of FVRCP is usually lifetime protection. But the problem is we're working with a system where there's a requirement for every 3 years, even though we know these vaccines last longer. But find a vet that's going to follow those WSAVA vaccine guidelines. That's key. So, yes.
Okay, so I have a question. So WSAVA, though, is the recommendation for the veterinarians. It's not the actual law, right? The law,
Correct.
if I'm correct, the law requires that the states require that animals are immunized, correct?
Yes.
Okay, so as far as like if we
Or
were
rabies, there is no
rabies.
law requirement for FVRCP or
Correct.
leukemia or FIV.
Rabies.
right,
Just
so,
rabies.
right, but it requires that they're immunized.
Correct, because there's a human safety. You have a public health issue.
Mhm.
That's the thing. So I think a lot of times, and this is me coming from the vet side, but also the holistic side too, because I resonate with both sides, and it's a hard place to be in because there is a human health risk because rabies is a deadly disease. Like, you don't want rabies. You have to go through a 7 injection protocol. Like, it's not a good thing to get. So if a vet's bit working with a cat that comes in and they're not vaccinated, they have to go through a rabies protocol. Like, they have to go and get vaccinated. So I can understand the human health safety side of things, but I also understand like vaccinosis is a real thing. So I can understand why there's a legal requirement when we do have rabies present. So because rabies is here or in a lot of states.
Right, absolutely. And I 100% agree with that too. However, correct me if I'm wrong, but a vaccine does not always equal immunization. Am I correct? Immunity, right? It doesn't, just because we have a vaccine doesn't necessarily mean that the immune system triggered the correct response. And it actually, for instance, my sister, she got the shingles vaccine when she was younger. And was it the shingles vaccine? I think so.
Yeah.
Yes.
Chickenpox?
It was shingles because she had some, but she went back and then she got titer tested later on and it didn't take. So she got 3 different shingles vaccines and it never took. So her system did not trigger a response with that vaccine, right?
So you can have non-immune responders. So that's what they're called. And that's where doing a titer test after you do one vaccine, you can see, does my pet produce antibodies? Now, here's the flip side. There's some really cool research that's just come out, and it's on the dog side, but I'm pretty sure it probably applies to the cat side too. But you can actually give an immune stimulant like beta glucans, which are part of mushrooms, really high content in mushrooms, will actually help stimulate an appropriate immune response to your vaccines. So you can supplement your cats using either a supplement, using whole food. A lot of cats, if you finally chop up like even just button mushrooms, cook them in a little bit of ghee, and you start feeding that to them, that's going to support their appropriate immune response to make it more likely that they even respond to that vaccination.
Yeah.
That's awesome.
No, I just went black. Sorry. My screen went black.
Ours is doing that too.
There we go, my turn. Yeah.
But this is what I'm saying, like why, and I just want to shout from the rooftops how important titer testing is and why it's not more prevalent and why more veterinarians aren't doing it. Why? Because I mean, like we should be doing this just to see if the vaccine worked.
Correct.
And then we should do it to see, our screen went by, and then we should be doing it to see if our cats are already, you know, it's just kind of common sense. You don't want to vaccinate, say feline leukemia, you spoke about, you don't want to vaccinate for feline leukemia if your cat's never going to be exposed to feline leukemia. Like, why would you do it anyway? But now if your cat has a immune response and is,
you're good.
Protected.
then
You're
why
good for life. Here's
Right.
the thing though. And I see the comments. You will come across vets that have no idea what a titer is. And you will also come across vets that refuse to do a vaccine titer. Here's the thing for everyone here. They can send the titers to the normal like testing clinics, like IDEX Labs is one of the most common blood test labs. Your veterinarian probably has an account with them or or they can send it to Colorado State University and get it done. But here's the other piece to this. If your vet refuses to do that, at least find a vet who will draw the blood and allow you to send that blood sample off to Dr. Jean Dodds at Hemopet. So if your vet refuses to do it, I mean, the problem that you might have is they may refuse to accept that titer result. That's the downside. And that's where so many people are coming up against a wall because veterinarians aren't being taught how the immune system actually works. And they're forgetting all their immunology education. Like it literally makes no sense why we would be pushing against these vaccinations. Because the thing that always irritates me, and it's irritated me for like years and years, is that it's not like your annual wellness, right? Who here has ever gotten, oh, you're due for your vaccines? I'm sorry, but your cat did not run out of antibodies. And now all of a sudden they got to go in and get vaccinated. We need to change the rhetoric to say you're due for your annual wellness exam, because the amount of times I pick up like disease conditions that were undetected or unknown to that pet parent, like on a physical examination, doing annual blood work to make sure the kidneys and the liver and everything else is okay internally, is more important than that vaccination. And we're focusing on the wrong thing as a vet profession. It needs to be about the preventative care, having a conversation about the pros and cons with these vaccines, doing the titer testing, and doing what's right for these pets. And so it's the more information we can bring to our veterinarians, and that's where even like the WASAVA guidelines, if you can print that out and bring it to your veterinarian and say, this is actually a recommendation, the titer testing is recommended, it's actually in the guidelines, you're going to be able to have a better conversation with them and just being a partner with them and being like, you know, I just don't understand, like, you know, according to these guidelines, you know, most cats have lifetime immunity to one injection of these vaccines. Can we please test and see where they're at? Because maybe they don't need this. And then let's talk about what are the other things like annual blood work or other things that we can do to make sure my cat's healthy. That's the conversation that will open that door to the veterinarian being open to this titers.
Yes.
So much.
Yes. I love that. I love your passion around that too.
So huge. I want to segue real quick into this about
Story.
Yes, because this is why we were so excited about this topic. Some of you guys know, many of you guys know that we found a little kitten back in middle of March, and we brought her in for to see if she was microchipped. She was not.
Microchipped. She wasn't
someone
spayed.
talking about microchips. I understand there's controversy about that. We don't.
Yeah, that's not the subject. We can talk about that later.
But we did not microchip her either. But
she was not microchipped. She was not spayed. She was not ear tipped, and we're pretty sure she was dumped. And most people would think she's probably not
hasn't been
vaccinated. So we need to vaccinate her, right?
But to Katie's point, this is what I want everyone to be thinking about as you listen to this story, how important and proactive it is to be able to have a conversation with your veterinarian from the minute that it's time to start making decisions. I think that the more that we can have that relationship, this is where this was so incredible. We had recently found this cat-specific veterinarian. We had left another practice because they would not touch our Panthers without giving them another rabies. We literally packed them up. We were at the vet's office. You guys know how difficult it is to take two cats to the vet. We were there. They would not see them. Instead of acquiescing, we walked out and we're looking for a new vet. So that is an option. I know that there's not a lot of vets in a lot of areas, but we were able to find this veterinarian. And from that moment that we started bringing our boys to her, and we had those conversations about what we feed and how we,
right.
So,
and she's very conventional, but she was also, you know, the way that we approached, we want to have a relationship. We want you to meet all of our cats. We want to bring our cats in for
their annual
wellness exams. We want to, you know, that this is what we feed. Are you okay with that? You know, so we started a relationship, started building a relationship. When we brought Annie in, we were like, can we get her titer tested? And she was like, sure, we can do that. Lo and behold, they didn't have an account to like even set up to do that. So we were like, it's fine. But we were like, you can go to Kansas State. You can, you know, we were just kind of like, we've heard whatever, if your lab doesn't do it, you could go here. And they were like, okay, we just need to set up an account and we will, you know, we'll do it because that's what you want. And they ran a titer on her, and it was our very first successful titer.
Be prepared for those conversations though of, well, you understand this won't matter to the law.
That's what they said to us.
We really don't need to put her through that. You know, we can just go ahead and get the vaccines. It's most likely that she hasn't been vaccinated anyway. She wasn't spayed. She's not, right? So that assumption, you guys know about our Pooh Bear, and I refuse to unlearn that lesson that he taught us with his beautiful life. So be prepared to be steadfast and be prepared to come with, I understand this may not matter to the law, but it matters.
Yeah,
we
said you have to speak up. You have to speak up, right? You have to give your cat a voice. Like, you are their guardian. You know, you are their guardian. You are guarding their life. You are guarding their health. You have the right to ask your vet questions. You have the right to ask your vet to discuss things with you, to have an open discussion with you. You have the right to gather more information. You have the right to get a second opinion. You have the right to choose a different vet. I didn't know any of that. I didn't think I could do any of that when I was dealing with Pickle. I know it wasn't vaccines, but you know, you have the, I don't want to say you have the power, but think of like Ninja Turtles, but you know, you have the capacity to give your cat a voice. And if you don't do it, no one else will. So be brave. And if you're not confident, get support. You know, like Katie said, you know, we put the link for the information. Do a bit of reading beforehand. You may not have all the information, but go there with something. I found that one of my vets was particularly combative if I started asking questions. And I said to him, I'm not questioning your diagnosis, your experience, but I'm just trying to understand. It's not about you, it's about me. You know, I'm trying to understand. So if you have that kind of vet, sometimes it's about understanding where they're coming from. You know, some vets don't like to be questioned. They don't like to think that you're, you know, diminishing their authority, like whatever it is, like that's their beef. But you are your cat's guardian and you have the right to give them a voice and to speak up for them. So peeps, you know, don't be afraid to ask. Sorry, Jay, I didn't mean to interrupt you, my love.
No, I think that's
important.
Yeah, that is important. True. And it is important that we, like you said, that we understand where they're coming from too, so that we're not, because I'm the world's worst. I fired, I don't know how many vets, and I did.
It doesn't say you're fired.
I know, but I did so almost combatively for many years, because, you know, they said they need to eat this specific prescription food, or I'm going to give them an antibiotic, even though you don't even know if they have an infection, or, you know, like things like that. And I was like, why are you dumb? No, I'm like, you know, like I was combative instead of being like questioning, opening up that conversation like we did with Annie, right? And when they came to us and they said, this isn't necessarily necessary because it's not going to be counted or whatever she said. And I was like, oh, are you speaking about the law? And she was like, yeah. And I was like, no, we're not doing this for the law. We're doing this for her health. We had another cat that was over-vaccinated and dealt with an autoimmune disease for his entire life. So we're doing this to find out if she has already been immunized from rabies. And so we just want to, you know, we want to do this for us. And they were like, okay.
For her.
Okay. Or for her.
And then the pushback too of, well, it's very expensive. And you know, there's layers to get through.
There's a link in the description, guys, where you guys can get it for
a better price. If you have a conversation with your vet to do that blood draw that Dr. Katie was talking about, the point is, be prepared. be empowered to recognize this is about a conflictual relationship with a veterinarian that may not have ever even heard about titer testing. This is about engaging in a relationship with a teammate, ideally for life, with your cat, to give your cat the best chance at the best life.
Yeah.
We need to have that relationship, and we need to be responsible.
I believe that every vet knows what a titer test is. Am I correct? Like that you're
They're titer tested.
Are they not?
I disagree with that.
Go on, Katie. What are you going to say? Katie?
I was going to say, I disagree. Can you hear me? Okay.
Yes.
Okay. I was going to say, like, I've worked with vets that I don't think they knew or understood what a titer test was. Like, once you explain it to them, then it starts to make more sense when you explain like the immune system and like how a vaccine works and what it's actually doing. But unfortunately, it's not being presented, and maybe it's different now, but I doubt it, because I'm not seeing a huge change with the clients I work with, that the newer vets are maybe being taught this as an option, but it's like, nope, here's your vaccine protocol, you're 6 to 8 weeks, you're 10 to 12, you're 14 to 16, you're 6 months for even cats now, then a year. And then ideally it should be every 3 years after that. Like, that's your traditional like vaccine protocol. You're not taught like, oh, we need to actually test. Like, it's ridiculous, right? Like, it's not a preventative approach or proactive approach to the care. So my question is, who is funding the immunology education in the pet program or in the vet schools, right? I have a feeling there's probably something there, just like the big pet food companies are funding a lot of the education that veterinarians are getting. Like, my knowledge around nutrition did not come from vet school. I don't care what any vet says, like 2 classes, 2 hours on like the GI tract, and your nutrition is all prescription food. Like,
Right.
you have to start looking at where is that education coming from for your cats, but also for the human side, because that's the thing. Like, why aren't we recommending something? Why are we giving something over and over again that's making these animals sick? And it's not preventing these diseases. It's just overstimulating that immune system. So I think unfortunately a lot of veterinarians don't understand that concept. I hate saying that, but I don't see it out there. I see the comments. I see people coming, like, even with this, if we left this up for long enough, right? And we invited a group of veterinarians to come in, I bet you half would not even know what a titer test is or where to get it done.
Wow.
See,
I didn't when I asked them for it.
Yeah.
Really? See, I thought that veterinarians have to be immunized from rabies as well. I thought that they
do, but I didn't, because I went to vet school in New Zealand, which was rabies free. I got lucky. So
States don't they need to be vaccinated for rabies as well, right?
But they do titer tests.
Right. So how would they not know what a titer test is if they're titer tested?
That's the question.
I don't know. I honestly, like, that is a great question, right? It's called not thinking.
Mm-hmm.
That's what it comes down to, is we're not thinking about what we're doing to ourselves and applying it to our pets who are very similar. Like, that's the thing. So
Yeah.
Well, let's tell you the news. So so Annie came back.
We did have that conversation with our vet. We did stay steadfast to give our cat a voice, and we did follow through with our titer test.
Expensive titer test.
It was an expensive titer test.
And she came back so fully vaccinated, like so immunized, like off the charts. She said the vet said that she can sign off for a cat to travel at 0.5, and she was at 5.3, which is huge.
Look at your man's face. That is the face.
Right.
Okay, wait. I'm going to just be the devil's advocate real quick, because I want to remind people what titers are also showing. Annie does not have rabies. Like, she doesn't have rabies, but a titer will look at your vaccine status and the immune system responding, but it will also look at if you've been exposed to that virus. So if you, like, let's say you get a kitten or whatever, like you come across Annie and she's acting like kind of feral. She doesn't calm down. She's like kind of vicious, and you go in and you get a titer test done and she came back really positive. The concern for rabies would be higher. So keep that in mind. Like, a titer test is looking at the response to either a vaccine that's stimulating for those antibodies against it, or it's a natural response to like being exposed to that condition. So a lot of people will do like natural exposure. It's more common on the dog side, right? Where you're helping stimulate that natural immunity. And you can do a titer test to see where is my animal? Like, what is the antibody level with a titer test too? So just keep that in mind also. I'm not, obviously Annie is beautiful and healthy and had a vaccine. Definitely. She was not rabid, but keep that in mind too, with like, in the future, if like, say your cat shows like Cleese virus or herpes virus, and you're like, oh, I should vaccinate them for this, right? Do a titer test and see like where are their antibodies. Are they actually producing antibodies to fight that? Because then you can use natural support to help that immune system. So that's how I look at that too. It's like, it's going to give you an idea. Is this a non-responder? Do we need to revaccinate, or are there other ways to support their bodies and their immune system, or keep them out of like boarding facilities by having someone stay at your house, or using something like trusted house sitters, which is worldwide, and they come and stay in your house and you screen them. Like there's a lot of ways to avoid having to get those vaccines, especially for cats.
Yeah.
And I think it's also important to look at, are these cats indoors? I mean, you don't need to vaccinate a cat with the FERCP vaccine when they're 10 years old and they live indoors. I mean, it's usually for kittens, right, Katie? It's really for the young cats. But like Dr. Falconer says, old cats don't die from diseases that we vaccinate them for. So we don't need to be vaccinating our cats for these things over and over and over again. It's not necessary. And especially if your cat is indoors and doesn't come in contact with any other cats, it's like, let's use common sense here.
Well, and it's like Jay says all the time, and I've been privy to conversations that she's had with people in our community just about them being caught between a rock and the hard place. They're dealing with a certain situation, and her really kind of walking them through the conversation to help them with their conversation with their veterinarian. But really, it is about, every vaccine comes with a risk. That's just the way we look at vaccines as being very healthy and helpful, but it's very important to evaluate those risks. Like you said, Pam, if we're dealing with indoor only kitties that we know are not going to be exposed to other cats, or whatever their risk factors may be, as Julianne is always pointing out, it's all about those individual situations. Evaluate the risk of the disease versus the risk of the vaccine. It really helps to put things in a very logical sense of what is going to be best, truly best for my cat. Look at the efficacy of those vaccines. If you're very concerned about feline leukemia, Dr. Katie Whitley, you started mentioning that. Speak a bit about the efficacy of feline leukemia vaccines. How we can't just be like, oh, I'm going to go get vaccinated for feline leukemia so I never have to worry about it again.
Well, I have to say, in our community, we've had so many people that have come to us and said, I vaccinated my cats for FELV and they got FELV. And so, yeah, speak to that.
I mean, here's also, I'm going to add in, it's not as common here, but it was they actually put it as a core vaccine in New Zealand, was FIV too. And, these vaccines don't have very high efficacy. Ask for the research articles from your veterinarian. That's the thing. I look at this and I see this on the human side too, with all we went through these past few years, right? I'm not going to bring it up and dive into that. But the thing is what does it go back down to? Are you feeding a species appropriate diet? Are you supporting the immune system? Are you reducing stress? Are you supporting emotional health? That's the beauty of this roundtable, all the amazing women here doing all the amazing things that Pam and Julianne and Jay and Adrian talk about, focusing on these different areas, because if we're only relying on a vaccine to give our cats optimal health, you're dead in the water. It's not going to work. And so we have to be aware of these other factors and thinking okay, well, I'm going to give the leukemia vaccine, but my cat's immune system is really stressed and not doing well. For one, that cat's probably going to be a non-responder, but would we know if we're not doing a titer? And we have to start looking at the bigger picture and the foundations of what truly is optimal health. And it's not that your cat lacks a vaccine.
Right. Yeah.
Right.
No, I mean, a strong immune system is the best defense against disease in all mammals, right? And all of us. A strong immune system is always the best defense. It's not a vaccine. Okay, let's talk about detox then.
Yes.
So when it comes to people here, right?
Imagine if we would have gone through with getting Annie.
I don't even want to know.
Yeah.
I can't even. I just want.
Yeah.
You didn't. You knew.
Yes.
I mean, I think that's an important reminder for everyone here, because the guilt is a thing. We've all, except for, Julianne, I don't know if it changed through this conversation. None of us have guilt about like the vaccine stuff. And I mean, the thing is that you are here to learn, and you will grow and continue to learn, and you'll reflect back and go, I wish I had known that then, but be grateful that you know it now. So you can help those pets. Those pets are the reminders of like, okay, I could have done better, but I know better now. And that's the most important thing. And I can share that with other people.
Yeah.
And
even after his death, Pooh Bear is still our greatest teacher, right? I mean, he's the one that saved Annie. I could cry.
And let's not get stuck in the guilt, though. I mean, I think that let's move up. Let's recognize, as we learned with Pam, that even if we do make a mistake that we need to learn from, it's not the end of the road. It's not done. Don't get stuck in that guilt. There are things that can help, and I'm going to go from here as far as being able to help our cats post potential too much.
Right. Well, from all of the testing and stuff that I've done on clients, and with the veterinary homeopathy guide that I've used for years, believe it or not, there are multiple homeopathic remedies that can be used to detox the rabies vaccine. But 99%, I would have to say 99.9% of all the clients that I have worked with, listen is the remedy that is the best match, hands down. Thuya doesn't even come close for the rabies vaccine. So listen, and then if it is like, here's a couple of things. When you're dealing with homeopathy, there's potencies, and a 30C is great if your cat has never had a rabies vaccine and this is a one-time deal. A listen 30C, probably 3 doses, morning, PM, morning, done. That would be great. But if your cat has had a rabies vaccine and it's been a year, 2 years, 3 years, 5 years, and you have this chronic disease process going on, and that can look different in every single cat, I would go back to use a listen 200C. I don't care if your cat got rabies vaccine 10 years ago, you can still detox it. So I would use a 200C because it has been so long, or there is a chronic disease process going on. So I would do probably twice a day for 2 days. I would use a liver lymphatic support product, like a liver defense from Animal Essentials, or like a detox blend from Animal Essentials. It supports the lymphatic and the liver together, so that the liver is supported through the detox process, as well as moving stuff out through the lymphatic system. So milk thistle by itself, not so great. What I have learned, I would definitely use that lymphatic support product as well. If the vaccine has any heavy metal in it, you're going to want to do a heavy metal detox, because guess what? The homeopathy and the liver lymphatic support is not going to get rid of that. So it's just another part of a detox process that I always incorporate, is a heavy metal portion. And then I do stuff like supporting the gut with a humic fulvic acid product, omega-3s, mushrooms, things like that are super immune boosting. But if we're talking about the FVRCP vaccine, and again, if it's the first one, or if it's something that's, one done, no issues, a 30C Thuya is perfect. I would do probably 3 doses, AM, PM, AM, or vice versa. If it is something, again, that's chronic disease process is present, or your cat had 3 FVRCP vaccines within the first 8 months of its life, you know, and you can go back and you look at all the history, I would just deal with 200C. I think it's more powerful. I think it's more, it probably is going to work on a deeper level than just a 30C for those kind of situations. So if a cat is going, if you are going into an appointment knowing that you're going to have to do a vaccine, I would prepare ahead of time. I would have your homeopathy in hand. I would have your supplements ready. And as soon as you get done, you are giving those doses, because you just don't know what could happen.
Yep.
And I would just rather be safe and be prepared than sorry.
Right. And these types of detoxes are safe for a cat that even if they weren't over vaccinated or vaccinated.
Oh, completely.
Yeah.
Homeopathy is a beautiful thing because it's you can make a remedy. This is what Dr. Falconer taught me. You can take 3 of those pellets and you put it in half a cup of water, and that is your remedy. And then you just use a syringe or a dropper and you pull out about half a milliliter, which is not very much at all. And you succuss it. So that kind of energizes the remedy. And then you just squirt it in his mouth or put it on a little bit of food or treat or whatever. It works the same, you know, is what they have found. So it's so easy. And cats, you know, they don't like medicine, but they don't mind water. It doesn't taste like anything. And you just save that remedy and you reuse it for those second and third doses or fourth dose, whatever it is you're dealing with, because you don't need to make a new one. It's perfectly good for like up to 5 days, and you toss that, you know, but toss it when you're done. So yeah, it's so easy to use homeopathy for these kinds of things. Now, you may have to be more creative in getting the liver lymphatic support in them, maybe baby food or a favorite treat, or, you know, something yummy that they won't taste that as much. But yeah, that's just important too. You want to support the liver. Katie talks about this all the time. We've got to support the liver in any kind of a detox process. Always, liver and lymphatics are very, very important.
Well, I mean, you can't escape the toxins that we're all just exposed to in the air, even so just giving our cats some detox support, even you know, pulse.
Yes. Mm-hmm.
Yeah,
absolutely.
Julianne, are there certain herbs that you have found that help in detoxifying the body, the liver, in general?
Do you know what? I'd probably pass that to Katie, because she's got more experience with herbs, with the effect on the physical body, because my experience of using them is mostly behavioral and emotional, with a side of supporting like painful joints or like an overarching like pain or discomfort. So in terms of like an immune boost, I would pass it over to Katie and see what she has to say on that one.
Dr. Katie.
You know, I love that, Julianne. I'm going to also, though, I'll answer that question, but too, with what Julianne does with the herb gardens and the self-selection, it is the most beautiful thing. And keep in mind, a lot of these cats are having the emotional health issues because of that. So a lot of the herbs that I'm going to recommend, but even, you know, working with Julianne with Tico when he was having a vaccine, like a vaccinosis, like being able to put down those herbs that are going to support where they're at, like emotionally, is going to help them physically and help make their bodies stronger and their immune system stronger to detox the chemicals and the things out too. So that's the nice thing. All these things we're talking about overlap. And with cats, each cat is an individual. So finding the thing that works best for them and works best for your personal situation is really important. But, you know, to couple with what Pam was talking about with some of these herbs, I mean, you can get silymarin, which is your milk thistle. Getting burdock root is really, really helpful. The other things too that, you know, I find for, you know, supporting them and helping to, like, I would be looking at, like, Julianne, I don't know, just feedback like Rose, if they're having, like, if they need to, and that, you know, Angelica too, if they're going through an experience that needs to be released. And the thing with some of the other herbs that we can use, I like combinations. So as Pam said, I've taught a lot about when we tend to reach for milk thistle, and it's a powerhouse at supporting it helps produce glutathione levels, which are an antioxidant. It also does bind to heavy metals too. So I saw a comment, how do heavy metals get into those vaccines? That's the adjuvant. That's the thing that creates that adverse reaction, but it's the thing that stimulates the immune system to kick in. So we need to add stuff to those vaccines to create an immune response. But unfortunately, that's the thing that can create the adverse reactions. But this is why it's so important to ask for thimerosal-free rabies vaccine, so that you're at least reducing the amount of those heavy metals. But those binders are really important too, because of those heavy metals. So if we think about it, we're putting in these chemicals, and then we're using certain herbs and nutraceuticals to detox them out. So it's getting out through the liver. Well, our cats also need the detox pathways are the kidneys. So using things like Rehmannia, using astragalus, which is a great herb to help boost the immune system, to make sure that we're clearing those things. But we need to make sure that those kidneys are open and we're removing that. But those binders are key also, not only for heavy metals, but other toxins. And when we think about, we're stimulating that immune system, and it can create more inflammatory mediators or other potential byproducts. Those binders will also bind to that. So if you ever, like, the next time you ever have a cold, or you think you're having the flu, or you have a sore throat, start taking activated charcoal at night before you go to bed. And what's amazing is a lot of time you'll wake up in the morning and you're like, I feel fine. And it's because it bound to the toxins that were being produced by your immune system, by the virus itself, and it inactivates it and removes it out of your body. So that's how the binder should work, is that they're going to bind that and get it out. But if your cat is constipated, or they're prone to, GI issues, microbiome issues, they have a kidney issue, we need to start like preparing those systems to handle that vaccine even before that vaccine happens. And there's so many great supplements that do that to support those systems and get it out.
That's a good point. I was thinking, when you said what herbs could help, my head went to like ingestion. What herbs do you put in the body to support the immune response? And Katie's right. I kind of forget my own job sometimes. There are other elements if your cat has sadly been over-vaccinated. How do you support them with that? So all the wonderful recommendations that the ladies have given, but there is an emotional and a mental toll, so we know when we're not feeling very well, whether that's like chronic toothache, or you've, broken a toe, like whatever it may be, it takes a toll on the body. And, we know that there's a connection between our emotions and our physical health, so how do you support the cat that, as we've mentioned at the beginning, the immune response is so chronic in the body? Everything's raging, everything's hot, everything's uncomfortable, they're itchy, they maybe feel nauseous. So my recommendation for a herb garden, which is different to supplements. So a herb garden is when you put down dried herbs and flowers on a towel or a blanket, you let the cat go to it and do what they need to. Okay, so it's different to adding it to food or offering it, putting it into the cat's mouth or anything. Like Katie said, rose would be my first. It's emotionally nurturing and horrendously supportive. It is like the softest, most loving remedy that you could give. So organic if you can, dried rosebuds, or if not, petals. Then I would probably say valerian root, because again, it helps with physical pain and discomfort, but also helps with anxiety. So if cats are having this immediate, immense immune response, God, try saying that 3 times quick. It helps to reduce that anxiety and to bring their emotions, back onto an even keel. Because if they are dealing with a chronic state in their body, they're bound to be stressed, worked up, anxious, and as Katie said, you can't just have a one-pronged approach. If you're going to offer supplements or medication or energy work or whatever it may be, like, you need to do a couple of things. We say, what's the one thing? Well, I think if you're dealing with a vaccine response, or over-vaccination, you may need to do more than one thing. You're going to need to have that kind of holistic, as Katie says with the W, holistic approach to supporting them. So I would say angelica root, I would say rose, valerian root, chamomile. We all know a cup of chamomile tea, how calming it is for us as humans. And I would say peppermint, which is the other cup of tea that we all know helps us, so it supports your tummy. So those would be the 4 herbs that I would recommend.
I love you
I
and
love
your
that.
herbs. I think Judith said it so well. Such a great like cherry on top when it comes to this and having tools to deal with over-vaccination. She said, your herb gardens and your book are exceptional. It was amazing to be able to help my cat help herself. And thinking too about that, the power of self-selection. We saw that with Andy when we first brought her in, laying down the herb garden for her and watching just to see it's got me goosebumps. What was comforting to her at that time in the shop, just right off the
valerian. That was beautiful. Yeah.
Right. So
that was awesome.
Like Dr. Woodley said, everything is so it overlaps. It's all very complementary. I love that everything that is shared about how we can help if we are faced with an over-vaccination thing, if we find ourselves between a rock and a hard place, if we have to do this, that we can arm ourselves with first and foremost with a conversation. You guys, this does not need to be ugly or confrontational. It is about our cats, and as Julianne said, giving them a voice. And if we are able to make the best decisions that we feel, absolutely fantastic. If we are caught between a rock and a hard place, there are things that we can do to arm ourselves to be very proactive past the point, and that it's all very complementary.
And just to comment on Brock comments that the vet said that there's nothing that he would recommend, don't give her anything before or after surgery. Like, that's not true. You can support them. You could offer herbs, you could offer sort of like a chamomile tea that's been cooled. Like, there are so many options to support post-surgery. Start looking at our content and stuff between the 5 of us. We've got you covered with how to support your cat. And if you're not comfortable with that, vet, think about getting a second opinion, because there's always more you can do for your cat.
Absolutely.
Yeah. Before we go, I wanted to share what Dr. Falconer recommended for these people who feel like they are put in a bad position for, apartment complex management companies. And I would even go as far as saying boarding facilities, and even your vet, if you are in a place where you don't have others to pick from and you're a small town or whatever. His advice was it went something like this, and I paraphrase: I will agree to your terms on one condition. If my cat has any kind of adverse reaction, develops an illness, sickness, whatever the case, within the next year because of this vaccine you're mandating me to do, then I'm holding you fully responsible, and you will pay for all of the medical bills associated with any outcomes.
I like that.
I thought that was brilliant.
Yeah.
You know what? It puts the onus on them. If you're going to require this, when I feel it's not in my cat's highest and best good, and they've had vaccines before, and they have they have illness, they have cancer, they have a virus that's contraindicated, but yet you still are wanting me to do this, then it's on you.
Yeah.
Well,
Now this is after the conversation.
Pause.
After the conversation.
Yeah.
So,
Do not use that for your management companies.
yes.
Your boarding facilities and things like that are just, it's not even it's not even a rational requirement. You know what I mean?
Yeah.
Those are the kind of situations that he was referring to.
Yes. And that's actually pretty brilliant.
One more quick question, and let's. And I love Brock mentioned earlier. Go around the horn is a sailing term, y'all. It's an actual thing. Aye, Captain.
I thought it was a basketball thing, but I'm wrong.
She just made it up.
I'm totally going to look it up. But real quick, Julianne, Cherry said, are those herbs good for post-op?
Absolutely. Yep. Chamomile, calming, on the body. Peppermint, soothing for any irritation, inflammation. Valerian and rose. Yeah, great combination.
I want to also mention Julianne's book, The Aromatic Cat, is such a brain trust of incredible things. We use this as when our babies are feeling a little angsty or whatever, we go and look up I think they're worried about all the sounds outside. What's good for fear? What's good for anxiety? What's good for, it is,
and it's got
such
all of it. It's
Bible.
Yes. It's like a Bible of herbs. Yes.
It's so helpful. Yes. And I think you can get it on Amazon, right?
Yes.
Yeah. So you guys have that. That is absolutely fantastic.
Yes.
Before we go, I know we're already over time. Any last lingering thoughts that we may have missed about this topic that you guys feel compelled to share right now?
For me, it's just be strong, be brave, ask the questions.
Yes.
That's
Yep.
mine.
I love that word brave. Be brave.
So true.
Yes.
Yep.
Because that's really the hardest part. Usually for us, we go in and it's either overconfident or underconfident, and you can just be brave and have that conversation.
Sometimes overconfident comes with an attitude that should be adjusted.
Right. But overconfident or underconfident, either one of them, whether if it ends badly.
It's not good for the human
It
dynamic.
ends badly.
Right.
Right.
I think the big reminder is to, if you're in a position, I know not everyone is, alongside what Julianne said, don't be afraid to get a second opinion. You know, if you can find at least a vet that's open to like listening and understanding, that's the key, you know, and sometimes you do have to drive a little bit to get that. So, but, you know, don't just settle for the one person because it's the only person that's the closest to you. You know, sometimes you do have to drive for, you know, finding that partner in your cat's care.
Yep. Totally worth it.
Yeah, I would say do your research in your home state and see what exemptions that there are for any rabies vaccines in your state, because they can vary state by state. I know that Texas has exemptions.
So does Colorado.
Yeah. So, but I will tell you, vets will not just lay that on the table the first time you kind of put your wall up. You're going to have to fight for it, and you're just going to you have to go in, like you said, you have your education, you have your facts. You know what the vaccine label says. The vet may not remember what the vaccine label says, but you can politely remind them, this is what it says. And my cat has herpes virus. It's contraindicated, you know. They have the power to write that exemption. So don't always think that they don't, because they can. They're allowed to use their professional, expertise, Katie, you know, in medical situations, and write those exemptions. So
Discretion.
Yes, better. Yes, discretion. Yeah.
Yep.
I mean, that's why they make exemptions. So, and when in doubt, just cry. It worked. It's worked for me. I just cried, and I won.
Well, or make a call to your spouse and
Be
be like, they
"They're
said
wanting it."
no. They said absolutely not. I'm sorry. I can't get a divorce over this.
Right. My final thought before we let you guys all go is that this whole conversation, and I feel so grateful to each and every one of you and to everyone here joining us today, is to ideally make, you know, as Annie has taught us, as Pooh Bear taught us, to try to make the best decisions for our babies. And that this is all about positive forward movement.
Yes.
It's about positive conversations. It's about doing our best, right?
And giving our cats a voice.
And giving our cats a voice. And I really feel like it's so empowering. It's all very positive. So don't feel let go of that conflictual stereotype around this topic.
Yeah.
I think that this is really an incredible, powerful conversation.
And I'm just going to end with this.
I was going to say, who is it that sat with you?
That
Look at Zorro.
Oh my
Are you going to
God.
be okay? Izzy?
Oh my goodness.
Please,
Okay, guys, we will see you tonight. We will be live for Q&A on TikTok and Instagram, 5:30 and 6 p.m. at Pacific time. And we love you guys so much.
Thank you guys
Yes.
so much
Mwah.
for this conversation. Thank you guys for joining us. We'll see
Thank you, everyone who joined us.
Thanks.
Thank you.
Happy Monday.
Bye, y'all.